Going forward, is it still distorted? Are we good, or do I keep talking? Again, Tuesday, the 22nd of December, 2020, the year we want all of us want to go away. All right, so I'm testing again. I see you just put your headsets back on just to make sure. And test 1, 2. Are we clear now? Okay, thank you. Glad we were able to work that out. All right, once again, welcome to the NIH. This is Tuesday, the 22nd of December of 2020. We're getting ready to host an event that I'm sure will be all exciting. And we're checking audio to our pool feed to make sure they have clear audio downtown as well. So we're checking, and I'll continue to talk. Again, this is in the Clinical Center in Masur Auditorium in Bethesda, Maryland, on the National Institutes of Health. And we're checking for the audio. We're good? All right, awesome, thank you.
Should I test the mic or, the mic, it's working fine? Okay. Somebody gonna give me a... Okay. Welcome to the NIH. I'm Colleen McGowan, Director of the NIH Office of Research Services, overseeing many of the campus operations that support the health and safety of the National Institutes of Health staff, including the vaccination program. We are here at the NIH Clinical Center, the nation's research hospital, often referred to as the House of Hope, where more than 500,000 clinical research participants have been active partners in medical discoveries since the hospital opened in 1953. Patients come from around the world to the NIH as partners in research, and we currently have 1,600 clinical research studies underway at the Clinical Center. Discoveries emerging from NIH-funded research results in better ways to prevent, diagnose, and treat disease to help people live longer, healthier lives, and reduce the burden of disease and disability. It is fitting that we gather here today on the NIH campus to administer vaccines designed to battle COVID-19 at the very place where much of the groundbreaking vaccine development work happened, both at the NIH Vaccine Research Center around the corner and here in the NIH Clinical Center. Additionally, the Clinical Center has several clinical trials to better understand COVID-19 and how best to treat it. This vaccine will help protect future patients and the healthcare staff who care for them. Today, we are kicking off the NIH COVID-19 vaccine program, beginning with opening remarks and followed by vaccinations. Importantly, additional Clinical Center healthcare staff will be inoculated over the next days and weeks as we receive additional doses of the vaccine from state health departments. Today's distinguished guests include HHS Secretary Alex Azar II, NIH Director Dr. Francis Collins, America's doctor, Dr. Tony Fauci, who is also the director of the National Institute of Allergy and Infectious Diseases, the NIH Institute leading the COVID-19 response. We also have 6 of our frontline healthcare workers who we consider our greatest heroes. We are honored to have them here today and know that they represent the hundreds of thousands of healthcare workers across the nation who are selflessly caring for COVID-19 patients, often at great personal risk. NIH thanks all healthcare workers for their commitment and dedication during this difficult time. Now I invite the NIH Director, Dr. Francis Collins, to the stage for his opening remarks.
Well, good morning to all of you on this historic day. The events of the last 2 weeks where not just 1, but 2 COVID-19 vaccines have been authorized for emergency use. Just 11 months after this virus first appeared on our radar have been truly astounding. Many prayers have been lifted up over this terribly difficult year that an answer to this global pandemic might emerge from the dedicated work of our scientists. I will admit that quite a few of those prayers were mine. And now it is with great pride and joy and gratitude that I stand here today, awaiting the historic moment when the first frontline healthcare workers at NIH, along with a few of our nation's public health leaders, will receive their first dose of a COVID-19 vaccine. I'm proud to say that the messenger RNA technology used for both of the COVID vaccines, now authorized by FDA, rest on fundamental research conducted right here at NIH, at our Vaccine Research Center 100 yards over there, and right here at our own clinical center. In particular, the Moderna vaccine being administered here today arose from a close collaboration of the company with NIH, established even before the COVID-19 pandemic began. Not only has NIH contributed fundamentally to the research underlying the mRNA vaccines, We're equally proud to have played a crucial role in supporting other COVID-related research across the U.S. That includes forming an unprecedented partnership with industry called ACTIVE to accelerate progress in therapeutics as well as vaccines. And it includes a program called REDx that put NIH in the role of venture capitalist to identify and scale up novel technologies for COVID diagnostics. Speaking, though, of rising to the challenge this year, let me introduce you now to my friend and a wonderful colleague who's been an absolutely vital leader in this effort, Dr. Anthony Fauci, director of NIH's National Institute of Allergy and Infectious Diseases. If it were not for the physical distancing requirements we are adhering to faithfully at NIH in the time of COVID, this auditorium would be packed with scientists rising to their feet and cheering for Tony's leadership in science and in public communication. So welcome, Tony.
Thank you, Francis, for that very kind introduction. I'm very pleased and honored to be here with you today to kick off this very important situation that we're in right now, is to initiating the vaccination by the Moderna product. As I was sitting there listening to Francis, I could not recall something that happened a long time ago in this very auditorium where many of you are sitting right now. When I first came to the NIH as a fellow in training for my medical residency in the summer of 1968, I was introduced into the extraordinary place that we are in right now, the National Institutes of Health, where so much of the research that has gone into conquering many of the diseases that we know now have really been addressed in such a way as they've had a major impact on the health of the nation. This is true of COVID-19. It is particularly meaningful to me as a member of the NIH for so many years to be receiving today with Secretary Azar and Francis Collins and several of our healthcare providers a vaccine that essentially had its origination in the fundamental basic research that's conducted here at NIH by our scientists as well as by our grantees and contractors over the years. This, what we're seeing now, is the culmination of years of research which have led to a phenomenon that has truly been unprecedented. And that is to go from the realization that we're dealing with a new pathogen, a virus that was described in January of this year, to less than 1 year later, to have vaccines that are going into the arms of so many people, including myself. And so I consider it an honor to be part of this process. So thank you very much. And now it gives me great pleasure to introduce to you the Secretary of HHS, Alex Azar.
Thank you, everyone, for joining us at the NIH today on this proud and happy occasion. I want to express my deep gratitude to Dr. Collins, Dr. Fauci, and so many members of the NIH team for their hard work throughout this pandemic, and especially on various elements of Operation Warp Speed. I also want to recognize and thank the staff of the NIH Clinical Center in particular. You have continued to provide care for patients who badly need it during this difficult time, and your work is heroic. I myself am a patient of the NIH Clinical Center. I'm so pleased to be here for this official kickoff of the vaccine developed by the NIH Vaccine Research Center, Moderna, BARDA, and other research partners, and I'm pleased to be getting this vaccine myself. We've all said it is nothing short of miraculous to have a safe and effective vaccine within 1 year of a novel virus becoming known to the world. But when we need a medical miracle, we know where to look. We look to the brilliant, dedicated scientists at the NIH, and we look to passionate, relentless researchers at America's innovative biotech companies. As a member of the HHS family, it fills me with great pride that the NIH and other parts of HHS played such a significant role in developing this vaccine, which will save thousands and thousands of lives and help bring this dark chapter to an end. In the long and storied history of the NIH, this is one of your finest accomplishments. I also want to recognize the years of work and investment that went into delivering this vaccine. It took more than just one remarkable year, but years of dedication to develop the mRNA vaccine technology that many once considered a long shot. Once we have defeated this pandemic, I believe that both the success of Operation Warp Speed and the mRNA platform technology pioneered by NIH and BARDA should reinvigorate our optimism about the frontiers of medical science and how we can bring the public and private sectors together to tackle our toughest challenges. When I look back on my time at HHS, putting together Operation Warp Speed will be one of my proudest memories, not only because OWS vaccines will save lives, but because they have reminded Americans to think big. When the government and industry charge together toward a really bold goal, we can achieve unbelievable things. I know that these kinds of efforts have been a focus for Dr. Francis Collins. The active partnership that he mentioned, which he has spearheaded under OWS, involves more than 20 pharmaceutical companies, other government agencies, and other partners. And the NIH has also continued to expand its Accelerating Medicines Partnership for other serious health challenges like Alzheimer's and schizophrenia. To close, I will note that as extraordinary as this scientific achievement is, getting this vaccine is more or less just like any other vaccine we receive. We have to follow the right mask wearing and social distancing precautions today, but otherwise, this is just like NIH healthcare workers or HHS employees getting their annual flu shot. Americans should also know that this vaccine has been through the kind of searching and independent review that they expect for any drug or vaccine at the Food and Drug Administration. I made it a personal priority to ensure that we were not cutting any corners in this development process, that the standards and data being used were fully transparent, and that the final decisions made on these vaccines were made by the same career FDA scientists who would make the decisions on any other vaccine. I'm honored to be receiving this vaccine today, and Americans can be confident in this vaccine and each vaccine the FDA authorizes for COVID-19. These vaccines are going to save so many lives and help bring this pandemic to an end. Thank you all for having me here today, and on behalf of a grateful country, thank you to everyone at the NIH for your work this year.
I'd now like to introduce Dr. Heike Balin, who is the acting chief of the NIH Occupational Medical Service, who will be administering the vaccine today to our participants, and she is assisted by nurse practitioner Judy Chen. Our first healthcare worker to be vaccinated is Ebenezer Mienza, a respiratory therapist. He has been here for 23 years. Ebby, while we set up, love to have you share with us why you decided to be vaccinated today. So this will be one of 2 doses that everyone will be receiving. There's going to be a 28-day interval between doses. So this is part of the consenting process that everyone will go through. So Ebby, will you share with us why you're getting vaccinated today?
Well, since this vaccine is about saving lives, my job as a respiratory therapist puts myself and my team members at the front square of this pandemic. Therefore, I cannot be more than happy about this historic moment.
Thank you for being part of this historic moment. Okay. 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 Wonderful. Great. The first NIH chair. You did good job. Thank you. Thank you so much. So as Ebenezer makes his way down the stage, our next person who will be vaccinated is Carlene Samaday, and she is a nurse in the Clinical Center's Procedures Unit. She's been here for about 15 years. Now, each of the participants today did get a fact sheet on the Moderna vaccine ahead of time, so they had a chance to read what it's all about, as well as the dosing that I described earlier about having a second dose in 28 days. At the conclusion of everyone getting vaccinated, they will be going to another location to be observed for about 30 minutes. I want to make sure there are no adverse reactions to anyone. So Carlene, could you tell us a little bit about why you decided to be vaccinated today?
Well, for me, it was pretty easy. I'm a healthcare worker, I work in procedure service, so I think vaccinating myself was a way to protect my patients, my coworkers, as well as my family.
Great. Protecting yourself and your patients and your healthcare workers. Wonderful.
Chance to review it.
Yes, I did.
Any concerns or questions at this point?
No.
No? Okay. And you're participating in GA program for the Moderna vaccine. And which arm? I'm sorry, I didn't quite.
We're going to use the left one.
I'm going to ask you this you have here. And have you hold that up. Okay. Thank you very much.
All right, Carlene.
Very good.
Thank you.
And you'll be getting a card and some.
My concern was everyone's going to say the same thing anyways.
There'll be a contact information on there if there's anything that's
I get
wrong.
the first opportunity.
Thank you. Appreciate it. Okay, great. Next, we have Dr. Jeff Stritch, who is a critical care medicine physician in the clinical center. He has a background in infectious diseases. He's also a commissioned Corps officer, so he'll be in his uniform today.
7/2/1984.
Which one would you like?
Left arm.
Left arm.
So Jeff, can you tell us a little bit about why you're deciding to be vaccinated today?
Sure. Really, first of all, I'm thankful to be getting the vaccine today. It's really, I think, to help protect my patients who I see every day who don't have COVID, to protect my colleagues who are there on the front lines with us every single day, and then to protect my family when I get home. And ultimately, the goal is to break the transmission cycle so we can get over the pandemic.
Well said. Thanks for sharing.
Thank you. Good morning, Dr. Stretch. How are you?
Good, thank you.
Good. So you'll be getting the Moderna vaccine under the emergency use authorization.
Okay.
And we drew up some doses, and I'm gonna, you said left arm, right?
Left arm, yep.
Yeah. If I can have you pull that up and, actually, let's see. As long as I get some muscle, right? There you go. If you can hold it right there, that'd be great.
Okay.
And just relax. Okay. Just hold it one more second. Right. Thank you so much.
That's great. Thank you.
The papers that you'll be receiving will have a phone number on them. You can call us around for Christmas.
Okay. Thank
All
you.
right.
Thanks, Dr. Stritch.
Okay. Appreciate it. Thank you.
Our next healthcare worker is Therese Kent. Therese is a nurse practitioner in the critical care medicine area.
Did you take this?
Thanks for being here today, Therese. Tell us a little bit about why you're deciding to get vaccinated today.
Well, thanks for having me. I am incredibly grateful to get this vaccine today. As my colleagues have said, we protect our patients and our fellow staff when we protect ourselves. And I truly hope this gives hope to others who have suffered so much this year, that hope is on the way, vaccine is here.
Thank you, Therese.
Okay. And we spoke a little bit earlier also. Thank you, Ms. Kent, for being here. And left arm.
Yes, please.
Thank you for holding it. You've done this a couple times before?
Maybe.
Everything ready here. Okay, ready? A little push.
You sure you did?
Not too bad. Thank you so much. And like we said, the phone number, in case there are any issues later, is on the paper.
Great, thank you.
Next, we have Dr. Neelam Giri, who is a physician from the National Cancer Institute. She also volunteers at the NIH COVID-19 symptomatic car line, and she works out in the elements to make sure we're all safe, in addition to her regular job.
Thank you.
Thank you. I think she needs to. Thank you. Can you tell us why you're getting vaccinated today?
Thank you. I'm honored to be the first few in line to be vaccinated to protect myself and everyone around me, and to be part of this campaign to end the pandemic.
Thank you.
Thank you. Thank you for being here.
I'm honored.
And I'm sorry, I didn't catch which arm you want. Left arm?
Left arm.
Okay. Let's make sure we get the muscle. And you read the papers that you were given.
Yep.
Any questions or concerns? And you'll have a
I'm fine
contact
with that.
number.
I'll scream.
That's okay. We're just on camera. Not to worry. You can scream. All right. A little pinch here. And if anything comes up, please do call. Okay. Thanks for everything you've done for us, too.
Thank you.
Thank you.
Our final healthcare worker today is Naomi Richardson, and she is a nurse who's been working at the clinical center for about a year, and she works with COVID-19 patients on the Special Care Studies Unit. Naomi Richardson. Naomi, tell us why you're being vaccinated today.
Well, I work directly with COVID patients, so I felt having an opportunity, why not?
Thank you for doing that. Thank you for
Nice
taking
to
care of
see you
COVID
again.
patients.
Okay. Any questions, concerns at this point? All right. You'll be getting the Moderna vaccine. You've read the information. You know how to get in touch with us afterwards. Excellent. And thanks for helping out. You must have done this a couple times before. All right. Little pinch. Thanks for holding that up. Okay. Thank you.
And a round of applause for all of our healthcare workers. So our next participant is Secretary Azar.
June 1767. Left arm, please. Okay.
So happy to have you join us today, Secretary. You shared some of your reasons for being here today, but can you tell us a little bit in your own words of why you're getting vaccinated today?
Sure. So as secretary, it's on my authority that these vaccines are authorized, and I want the American people to know that I have absolute and complete confidence in the integrity and the independence of the processes used by the FDA to approve these vaccines, that I have complete confidence in the safety and efficacy of these vaccines. And I am just so grateful to NIH and Moderna and all the participants in Operation Warp Speed for bringing us to this point where now we can see the light at the end of the tunnel from this dark period. So thank you.
Thank you.
Thank you, Mr. Secretary.
Thank you.
Any questions or concerns?
No.
All right. Just 1 second. Just a little Band-Aid just in case it bleeds. Thank you so much, sir.
And thank you to NIH.
That's your return card.
Next, we have Dr. Tony Fauci.
Hi. 12/24/40.
So many in our nation are saying, if Dr. Fauci gets the vaccine, I'm going to get the vaccine. So tell us a little bit of why it's important.
Well, for me, it's important for two reasons. One is that I'm an attending physician here on the staff at the National Institutes of Health Clinical Center, and so I do see patients. But as important or more important is as a symbol to the rest of the country that I feel extreme confidence in the safety and the efficacy of this vaccine, and I want to encourage everyone who has the opportunity to get vaccinated so that we could have a veil of protection over this country that would end this pandemic.
Thank you, Dr. Fauci, for coming today. Any last-minute questions, concerns?
No?
All right. I'm going to just scrunch up a little bit here. Sure, I get a good intramuscular injection here. Thanks for helping out. And pinch. And before you let go, let me put a Band-Aid on. There we go. Okay, super. Thank you so much.
All right, Dr. Fauci, thank you. Next, we have Dr. Francis Collins. Dr. Collins, tell us about why you're getting vaccinated today.
Well, it's an incredible privilege to serve as the director of the National Institutes of Health, where so much of this work has been happening over the course of this tumultuous year. I get to talk a lot about these vaccines and their promise for ending this terrible global pandemic. But it's one thing to hear me talk about it, it's another to have me roll up my sleeve and say, I believe that this is the way we're going to get through this. This is something that the evidence has shown in rigorous scientific analysis to be safe and effective. So I'm rolling up my sleeve and I'm saying, Dr. Balin, bring it on.
All right, well, thank you so much. Thanks for coming and showing us the way. Long pinch here.
Are you done yet?
Oh, I just got lucky.
That was no problem, people.
Excellent. Thank you very much, sir. And Ms. Chan is going to give you a couple papers for the break.
Yes.
All right.
Thank you. Thank you. And let me just say a word of thank you to Colleen McGowan, who has served as our MC for this historic occasion, and who is now getting herself in line to be the next person to receive the vaccine. So Colleen is going to tell us in a minute why she decided to get vaccinated. Now that you've quizzed everybody else, I get to quiz you.
I can't feel any of those answers. So I'm a mother of 2 children, so I think it's important as a mom to show other mothers that this is an important thing for us to do for our children. I'm also hoping to chronicle this on Facebook for all my naysayer friends to show them that it's safe and effective.
All right.
Okay, thanks for coming. Hoping to show us the way as well. Okay, any last minute questions or concerns? Okay. You're of course wearing the ideal shirt. And I'm just going to put a little Band-Aid on there. Okay. Super, thank you. And then on the way out, we'll do some.
Well, thank you, everyone, for joining us today. This clinical center has been referred to for its 67-year history as the House of Hope. It's been home to countless medical advances, many in vaccine research. Today represents yet another profoundly significant historical moment for us. It's deeply gratifying to have these halls at NIH now take part in the light that's starting to appear at the end of a long, dark tunnel called COVID-19, a light made possible by the power of NIH science and our many partners. So as a closing prayer of gratitude at this season of giving, I don't think I can do better than the words of David from Psalm 103. Bless the Lord, O my soul, and forget not all his benefits, who forgives all your iniquity, who heals all your diseases, who redeems your life from the pit, who crowns you with steadfast love and mercy, who satisfies you with good, so that your youth is renewed like the eagles. Bless the Lord, O my soul. And the people all said, amen. Our event is concluded. I want to wish each and every one of you and your loved ones a most happy and, yes, a most healthy holiday season. We are adjourned.